I'm Professor Ian Hickey from the Brain and Mind Research Institute at the University of Sydney. My team and I work on using new systems to encourage people with major behavioural difficulties to change their behaviour to improve their health outcomes. One of the biggest problems we face in clinical medicine is that we provide advice to patients about behavioural change on key risk factors, but their behaviour never changes. We need smart systems that help people to make the behavioural changes that will really improve their health. Worldwide, people have spent a lot of money trying to change behaviour around smoking, around diet, around physical activity, around sleep-wake cycles, around mood. So far, very few people have succeeded in achieving sustainable, long-term behavioural changes that really work.
I've got this great new app that I've been using with my patients, and
the market here is very large for a successful system that actually gets large numbers of people to change key behaviours. What's so smart about this system is that an individual person will be able to leave a clinic and test whether what the doctor has recommended actually works and come back and show the doctor, guess what? It didn't work. I need to engage in a new intervention and then test whether that works. In this situation, the patient's empowered to control their own healthcare and implement what actually works for them. There is no shortage of devices, websites, information, doctors' sheets, information about health. There is a complete lack of interactive technologies and socially and behaviourally smart systems that actually enable a person to change their own behaviour in a way that works for them. In our clinical studies with younger people, ageing population, physically unwell populations, we've demonstrated in principle how you can achieve behavioural change through these smart systems. This project takes this to the next level, implementation in real primary care systems in large numbers to show that this will work at the population level. It's clear why patients want these systems. Monitor their own changes in behaviour, monitor their own health outcomes, be in charge. It should be clear why health systems should also want these new systems. Rather than spending an enormous amount of time telling people what to do, finding out it didn't happen, it didn't work again, and giving the same advice over and over again, these systems actually allow efficient use of health practitioner time by actually providing the system that the person can use, and then when it doesn't work, returning as to why it hasn't worked. So from a health system point of view, this is much about efficiency and using our skill in much more productive ways. The great advantage of these new technologies is that a small number of people using smart systems and specialised information can reach large numbers of people in partnership with health system providers, insurers of healthcare, and many others who can promote worldwide better health through the use of smart systems and not many clinicians and many clinics. So the business model here trades on technology and rapid implementation at scale.